By the end of this video, you will understand what hypertension is all about. So many of us think hypertension is a disease of the elderly. It is totally wrong because a 4-year-old can have hypertension, 10 years old, 15, 16, 17 can all have hypertension. In blood pressure, there is a range. When it is high, it is called hypertension. When it is low, it is called hypotension. And when it is normal, it is called normal blood pressure, which causes no problem. In our body, we have what we call circulatory system. We all know that the heart pump and supply blood to our entire body system through the blood vessels. For us to have a better understanding, let's look at this scenario. When you go to a car wash or a garden, you will see that these people are using hose pipe. And if they want this water to go a far distance, they will compress the mouth, thereby applying pressure, which allows this water to go a very long distance. And if they want to reduce the pressure, they will just allow it open. This is what happens in our body system. When there is constriction in the blood vessel, it narrows the pathway, thereby making it very difficult for a free flow of blood in the blood vessel. And just like we said earlier, it will then create pressures in that area. This constriction could be as a result of formation of fat plaque in the blood vessel, or sometimes scar formation. Anyways, both of them narrows the blood vessel and lead to hypertension. If by chance the blood vessel get blocked by this situation, it can lead to so many complications. If it happens in your eyes, that means you will get blind. If it happens in your feet and hands, you will start having some tingling sensation. If it happens in your brain, you start having constant headache, dizziness, sleep disturbance, and sometimes it can even lead to stroke. If it happens in your heart will stop working and you will have heart failure. In this situation, somebody who is so young and looking so healthy can suddenly collapse and die without knowing they have some underlying issues. This is also one of the reasons why hypertension is seen as a silent killer. There are so many things that can cause hypertension. We have the modifiable factors and non-modifiable factors. The non-modifiable factors are genetics, family history, and age. The modifiable factors are smoking, excessive intake of salt, excessive intake of alcohol, stress, as well as obesity. So for you to prevent your chances of having hypertension, you need to reduce your salt intake, have a healthy weight, stop smoking, and stop taking alcohol. Most importantly, always check your blood pressure. You can be having hypertension without you knowing. And I hope you learned something new today. If you have watched this video up to this level, I would love to hear from you and your thoughts about hypertension. Put it on the comment section. Thank you and bye-bye.